Good afternoon, everyone. Welcome to our webinar titled Centering Self-Compassion and Mental Health Programming with Latina Immigrant Women. Hope everyone is having a wonderful day. Next slide, please. My name is Maxine Henry, the co-director for the National Hispanic and Latino Addiction Technology Transfer Center. I will be your host for today's webinar. Next slide, please. Before I introduce you to today's presenters, here are some brief instructions about today's webinar. This webinar will be recorded and archived for future playback. It will also be dubbed or closed captioned in Spanish and Portuguese. Actually, it will not be dubbed or closed captioned in Spanish because we'll have our Spanish episode tomorrow, but it will be dubbed in Portuguese and later for view, ready for view later. A copy of today's presentation will also be made available after the webinar. The lines will be muted throughout the presentation so as to minimize background noise and other interference. When we get to the Q&A portion of your webinar, you will have an opportunity to ask questions by clicking the Q&A box, and I will present your questions to our presenter. We will also be asking you to fill out a brief survey at the end of this webinar. This satisfaction evaluation is important to the work we do and provides us the opportunity to improve our training efforts. Although we did not secure continuing education credits for this event, we plan to do so for future events. We will be sending instructions for obtaining a certificate of completion to all attendees after the webinar has ended. Next slide, please. Let us start by introducing the National Hispanic and Latino Addiction Technology Transfer Center and our team. The National Hispanic and Latino ATTC is housed at the National Latino Behavioral Health Association, which is located in New Mexico. NALBA was established to fill a need for a unified national voice for Latino populations in the behavioral health arena and to bring attention to the great disparities that exist in the areas of access, utilization, practice-based research, and adequately trained personnel. The mission and the goal of the NALBA is to influence behavioral health policy, eliminate disparities in funding and access to services, and improve the quality of services and treatment outcomes for Latino populations. Next slide, please. In order to meet our objective of providing national leadership on Latino behavioral health concerns, NALBA has chosen 6 major areas of focus: targeted capacity expansion of mental health services for Latinos, Latino behavioral health evidence-based practices, legislation to increase the number of counselors, therapists, and other behavioral health practitioners, funding for co-occurring disorders of alcohol and substance use, the opioid crisis in the Latino community, and suicide prevention. The NALBA's executive director is Fred Sandoval. Next slide, please. Our ATTC is part of the ATTC network, which is a multidisciplinary resource for professionals in the addictions treatment and recovery services field. Established in 1993 by the Substance Abuse Mental Health Services Administration, or SAMHSA, the ATTC network is comprised of 10 domestic regional centers, 2 national focus area centers, and a network coordinating office. Together, the network serves the 50 US states, the District of Columbia, Puerto Rico, the US Virgin Islands, and the Pacific Islands of Guam, America Samoa, Palau, the Marshall Islands, Micronesia, and the Marina Islands. Here you will see a map of the US-based ATTCs. The National Hispanic and Latino ATTC has a national focus for Hispanic and Latino communities and the workforce that provides services to these communities. Next slide, please. The mission of the National Hispanic and Latino ATTC is to provide high-quality training and technical assistance to improve the capacity of the workforce serving Hispanic and Latino communities in behavioral health prevention, treatment, and recovery services. We disseminate and support the implementation of evidence-based and promising practices to enhance service delivery, promote the growth of a diverse and culturally competent workforce, and bridge access to quality behavioral health services. We are committed to increasing health equity and access to effective culturally and linguistically grounded approaches. Next slide, please. Our ATTC is staffed by Dr. Pierluigi Mancini, who serves as our project director. I, Maxine Henry, serve as the project co-director, and Ruth Yanez is our executive administrative assistant. The National Latino Behavioral Health Association is also the home of our sister TTC, the National Hispanic and Latino Prevention Technology Transfer Center. We will be providing contact information at the end of this webinar. Next slide, please. And now it is my pleasure to introduce you to our esteemed presenters for today. First, we have Dr. Serena Maurer. She is a mindfulness education specialist for Amigas Latinas, Motivando el Alma, in the Department of Health Services at the University of Washington. This work draws on her background in academic research on perceptions and realities of Latinx immigration, as well as her experience designing and facilitating mindfulness and compassion-based programming with Latinx immigrants in community-based settings. Serena feels grateful she gets to continue to offer Latina immigrant women opportunities for coming together to nourish her own and each other's mental health through her work with Alma. And Georgina Perez. She's a research coordinator in the Department of Health Services at the University of Washington. As a bilingual and bicultural licensed clinical social worker, Georgina has worked at Duke University, Seattle's Children's Hospital, and the Fred Hutchinson Research Center, providing medical health care to underserved populations. She is passionate about addressing Latinx mental health disparities through community-engaged research and education. It is such an honor and a privilege for us to work with you, ladies. Please take it away.
Hello, this is Serena speaking. So nice to be here with all of you. We're so happy to be here with you and to have the opportunity to talk about self-compassion in programs for Latina and immigrant women by sharing about a program that Gigi and I have had the privilege to develop and facilitate, Amigas Latinas Motivando el Alma. We'd like to begin by getting a better sense of where you're all coming at this webinar from. In order to do that, we have a polling question. The question is, which of the following best describes your work environment? If you wouldn't mind taking a minute to respond to the question so we can have a sense of who's in the virtual space. Great, thanks to those of you who replied to the question. It looks like the largest percentage of those attending are part of nonprofit organizations, followed by government agencies, community mental health clinics, schools, college, or universities. Those are the top categories. So it's helpful for us to have a sense of where you're working and how what we're doing with this program, Alma, might be helpful to you in your work. So Amigas Latinas Motivando el Alma originated as a community-based pilot program in North Carolina as a collaboration between researchers and staff at Duke University and the University of North Carolina at Chapel Hill. The principal aim of the Alma program is to reduce anxiety and depression amongst Latina immigrant women. It is an 8-week program, 25 participants, and 2-hour weekly group sessions. We conduct the program in collaboration with and on site at 2 local Latinx community organizations. We consider the Alma program strengths-based in so much as we invite participants in the program to recognize and share with one another the ways they're already supporting their mental health, strategies they're using for working with stress and challenging emotions, and the ways in which mindfulness, compassion, and self-care already exist within all of them. The program centers embodied mindfulness and self-compassion practices in order to cultivate open-hearted awareness of stress and emotions, how these live in our bodies, and how we can take good care of them, and as a result, how we can take good care of ourselves. All communications and sessions of the program are in Spanish. And we focus on community building amongst program participants throughout the duration of the program through sharing weekly home-cooked dinners, story sharing circles, and other opportunities for sharing and deep listening to each other, as well as things like group hugs, group art projects and theater activities, group yoga, and group relaxation practices. We have on-site Spanish-speaking childcare and public transportation funds available for anyone who needs and wants those. And the program is part of a National Institutes of Health funded research study that seeks to evaluate the program's ability to prevent anxiety and depression amongst Latina immigrant women. For the purposes of this study, we survey program participants before, during, and after they participate in the program. So the Alma survey that is completed at 4 time points before, during, and after the program includes questions about social support in the lives of Alma participants, stress, discrimination, mental health, healthcare utilization, mindfulness, coping, and resilience. So as we ask in our first weekly session of Alma, we'd like to ask you, what strategies are you using to support your mental health? Maybe you're doing things like taking a walk, talking with a friend, speaking with a therapist, breathing or meditation practices, or something else. Thanks for those who chose to answer that question. Looks like the highest percentage is all of the above, which is exciting to see. Followed by talking with a friend, exercise, and taking a walk. As is true for participants in Alma, it's helpful for all of us to get ideas and support from one another about how to support our mental health, especially in these challenging times. So thanks for answering that question and sharing with us what you're already doing. So here's a bit of background on the Alma program. First of all, research has demonstrated that Latina immigrant women are at higher risk for poor mental health compared to non-Latina immigrant women. Research has shown that immigration-related stressors contribute to this risk. These include things like trauma experienced during migration, limited access to social services within the United States. And also we can look at the current political climate and the ways in which it increases fear of deportation and discrimination. Research also shows that social networks and social support are important resources for Latina immigrant women. So Alma exists in response to research showing both higher levels of poor mental health and the importance of social connection amongst Latina immigrant women by offering a community-based, culturally grounded opportunity for Latina immigrant women to come together to learn about and foster their mental health through open-hearted awareness of and compassion for the challenges and feelings they experience. So this slide gives a brief overview of the curriculum of our program, just demonstrating what we focus on in each session of the program. We set up 4 focus groups on site at our partner organizations to ask Latina immigrant women what they're already doing to support their mental health and what they would like to see in a program to support Latina immigrant women in order to help us create a curriculum that responds to what they're wanting and needing. So this is the curriculum we developed in response to those focus groups, and Gigi and I are going to go through and talk a little bit about each of the sessions. In the first session, we really focused on arriving, settling in, and connecting with one another in the program. We establish agreements about how we want to be with each other and talk with each other. We discuss mental health and invite participants in the program to share strategies they're using to support their mental health. And we finish the session with a guided body relaxation, inviting participants from the very beginning of the program to start practicing compassionate rest and awareness of what they're feeling in their bodies, hearts, and minds. Our second session focuses on stories of migration. We set up migration storytelling circles in which we ask participants in the program to tell whatever stories of their migrations want to be told at this moment. In this session, we also begin our mindfulness of the breath practice that we continue through the rest of the sessions.
In session 3, it's about stress and life in Washington. During the session, we asked the participants to write down the major stressors in their lives on Post-it notes and place them on the branches of the tree of stressors, which is a large drawing of a tree. The tree of stressors helps the participants feel less alone with their stress by seeing connections between the stresses they each feel. It also reminds them that they're strong like a tree, that their branches can move side to side with the winds of stress, but their roots are firm in the soil and their trunks are solid and stable. We also use a sponge and water to demonstrate how stress affects our body. The sponge representing our body and the water representing our stress. As we add more water to the sponge, it expands. If it has too much water, it drowns. So this activity helps participants visualize how stress can affect our minds and bodies, even just with a little bit of stress.
In the fourth session of the program, we focus on interconnectedness and support. We have a centering activity that I'll talk a little bit more about later, in which we invite participants in the program to feel a sense of connection with the earth under their feet, with loved ones, and with others in the program. In this session, we also do a mindful eating activity where we spend time connecting with the piece of fruit that we do the mindful eating activity with where it comes from, the soil, the tree it came from, the sun and rain that fed the tree, and also connecting with all the people that made it possible that we could have this fruit in our hands and be able to eat this fruit in this moment. In the fifth session, which we call Homecoming, we spend some time talking about and identifying different emotions that we experience and how we experience them in our bodies. We also do another guided body relaxation in this session with our hands on our hearts to feel into our bodies the ways we experience emotions in our bodies and to offer ourselves self-compassion. In the sixth session, we dive deeper into our mindful awareness and compassion for difficult emotions and talk about how to work with them in moments that feel especially challenging. In this session, we also write letters to ourselves that we call self-compassion letters. And these letters are meant to be opened in a moment that feels emotionally difficult. And in the letters, we tell ourselves what we feel it would be helpful for us to hear when we're experiencing a difficult moment.
During session 7, we talk about Alma in our daily lives. The participants have an opportunity to make an Alma soul collage. So we provide the participants with scrapbook paper, magazines, stickers, all types of crafting materials to create a collage of what Alma means to them. While they're making their collages, we play calming and relaxing music in the background, and we go around and share our family sayings or words of wisdom. And in Spanish, those are called dichos. In the last session, session 8, we have a celebration. We have a gratitude circle where each participant lights a candle, and we have the opportunity to say something we're grateful for in ourselves, really taking a moment to appreciate ourselves. We also have a potluck where the participants bring a special treat to share with everyone. So it's really nice to have just some sort of celebration and party at the end. This is a picture of our Alma booklet. We worked closely with a local Latina artist named Yvonne Poveda, who helped us design the Alma booklet and develop the character of Alma that you see here on the front cover and is featured. And this includes the practices we cover as well as the songs we sing and other activities. The participants can take the booklet home and revisit the Alma activities as well as share with their loved ones. In Alma, we do not specifically focus on substance use, but the practices are supported for people whose substance use is connected with stress, depression, and anxiety. Now, Serena and I are going to share with you the practices we covered during the Alma sessions. The first practice is called body awareness. During the sessions, we guide the participants through a body relaxation practice where we invite them to notice different parts of their bodies, like their hands, arms, shoulders, and feel gratitude for each part and for themselves. This is all part of self-care, self-love, self-appreciation. We encourage the Alma participants to try this themselves at home when they're lying down to go to sleep at night or sitting with their kids or in the bath. The next practice is mindfulness of the breath. We remind participants that there's no right or wrong way to breathe. We're just practicing friendly, non-judging, compassionate awareness of how we're breathing, whether it's deep or slow, short or fast, as a powerful practice for calming and balancing our mental and physical health.
So I'm gonna leave these two drawings up here for a moment while we offer a short practice that combines some of the different elements we practice with in Alma. So if you feel interested in, drawn to trying out a short practice right now, please feel free to find a comfortable place to be in. You might want to just sit on a chair with your feet on the floor, or you can lie down. If you have somewhere you can lie down comfortably nearby. Seeing if you can find a position for your body in which you feel both alert and relaxed. If sitting, it can be helpful to rest your feet on the floor and feel the support of the earth underneath you. Or if lying down, you can feel this sense of support underneath your whole body. You might choose to close your eyes to reduce the distractions, visual distractions in the room, help you drop in. Or maybe you'd rather just allow your gaze to lower and soften, leaving your eyes partly closed. So now as we start to settle and arrive, you can take a few slow breaths to begin to help quiet the body and the mind. And then letting go of any attempt to control the breath, you can rest your awareness on the breath just as it is, entering and leaving your body. Not trying to change it, just giving it space, allowing it to move in and out. Aware of your chest and belly filling with each inhalation. Aware of your chest and belly emptying with each exhalation. Air coming in, air going out. Like waves coming and going on the sand. If you notice any thoughts arising, welcoming them, inviting them to show up and move on. Gently and sweetly bringing your awareness back to the breath. Now you can allow this awareness of air moving in and out of your body to remain softly in the background as you open your awareness to also include your feet. Aware of your 10 toes, of the bottoms of your feet, of your heels, of your ankles. Aware of what you feel in your feet. Maybe a sense of heaviness or tiredness. Maybe warmth or coolness. Allowing whatever you feel to be there, fully accepted and welcome. Slowly and gently moving from your feet to your legs, your lower legs, your knees, your upper legs, your hips. Aware of any sensations you feel in your legs. Achiness, lightness, tingling, strength, or any other sensations you can feel right now in your legs. As you breathe in and out, allowing your awareness to rise up into your torso, settling into your lower back and lower belly, into your middle back and mid belly, into your upper back and chest. Noticing and allowing whatever is here now in this part of your body. Any sense of tension, relaxation, maybe pressure, release. Slowly and sweetly moving from your upper back and chest into your shoulders, into the tops of your shoulders, inside your shoulder joints. Noticing and allowing whatever is there. From your shoulders, allowing your awareness to cascade down your arms, into your upper arms, through your elbows, into your forearms, sliding from there into your wrists, your hands, and each finger resting and relaxing. Moving now up into your neck and your throat. Into your face, forehead, eyes, area around the eyes, ears, cheeks, jaw, in and around your mouth. Noticing and allowing whatever you feel in your neck and throat and face in this moment. Allowing these parts of your body a sweet moment to rest and relax. Now slowly and gently bringing your awareness back to your breath. Air coming in, air going out. chest and belly filling, chest and belly emptying. Taking your time, feeling your feet on the floor or your body lying down. Feeling the soft touch of air in the room against your cheek. Noticing when you feel ready to open your eyes and come back. Gently, sweetly, as if touching the cheek of a child, waking them from an afternoon nap.
Thank you, Serena. That was very relaxing and very much needed during this time. Now we're going to continue with sharing the practices that we cover during our sessions. This is our third practice we cover, which is mindful eating. This practice is about connecting with the food we eat, the soil, the rain, the sun that nourished it, all the people who made it possible for us to eat this food in our hand, the smell, the taste, practice in slowing down, appreciation, and connection. The fourth practice is loving self-talk. This practice is about noticing how are we talking to ourselves. Are we talking to ourselves like we would do to a friend or a loved one? Are we doing it in a kind and compassionate manner?
This first practice on the left, with a picture of the character Alma with her hand on her heart, is a practice for challenging moments. The idea is that when we're in an emotionally difficult moment, we can first just stop and take a breath. And from that place of stopping, we can begin to accept whatever's here. So we talk in Alma about how this acceptance isn't necessarily of what's happening to us. Maybe someone isn't treating us well. But the acceptance is of what's happening within our own bodies, hearts, and minds. Accepting the anger that's arising, the sadness, the fear, and then offering ourselves sweet care for whatever is arising for us in that moment. The character Alma has her hand on her heart because we encourage women in the program to put their hand somewhere on their body that feels like self-care. Maybe on their heart, maybe on their belly, maybe a hand on a cheek, or maybe a hug, to physically signal to their bodies a gesture of self-care, self-compassion, and self-love. The picture on the right of this slide is a picture meant to signify the kinds of movement we do in the program. A number of times throughout the course of the program, we take some time to do some slow movements of our bodies that is really focused on listening to what our body needs in that moment and responding with love and care. So for example, we'll stand together and start to move one of our shoulders a little bit and see if we can notice what that shoulder is needing. And then begin to move that shoulder in the way that it really wants to be moved. Maybe it needs some stretching. Maybe it needs some bigger circles of the arm to help it loosen up. Maybe we're feeling some pain in the head, and doing some circles with the head might help to release tension in our neck that's contributing to pain in our head. This drawing relates to the centering practice I mentioned earlier. This is the most complex practice that we do during the program. And it's based on a practice of connecting in all directions. So we start connecting down through our feet with the earth that's supporting us underneath. The drawings of the leaves and flowers are meant to evoke our connection with that earth. Then we connect up through the top of our head into our own inherent dignity. The drawing of the heart with the gold light around it is meant to evoke opening and connection across our chest with ourselves, our own heart, and also with others around us. The person whose back is to us is meant to represent ancestors that we can connect with if we lean back into those people who have our back, have their hands on our backs supporting us, people who came before and made the path for us to walk on. And then the small childlike figure partly facing us is meant to evoke the future generations that we're also connecting with, looking forward with our eyes on the horizon, aware of how our actions today affect those who will come after us. The final part of the centering practice is connecting down into our own bellies as a way of connecting with what really matters to us in whatever moment, and allowing any action we take to be organized from and around that.
During the 5th session, we focus on emotion identification. One of our former Alma research assistants, Francisco Rios Gasas, created these characters showing the complexity of our emotions. The participants gathered in small groups and shared what they noticed in each picture. It was interesting to hear the participants' observation on what was going on with each character and how they present emotions similarly or differently to what's in the drawing. Here's a picture to give you an idea what the Alma sessions look like. In the beginning, in the front of the room, we have a meal where the women are able to share a meal with their kids and have their kids there and be with the other participants. And then we also set up the room. So towards the back, we end up putting up mats and blankets and cushions for the body relaxation activities. And this gives you an idea of just kind of how we set up the room with the mats. Here is a picture of one of our guided body relaxation practices. We encourage the participants to really take care of themselves, practice compassion for their tired bodies, and model this. As facilitators, we spread a blanket over them or slide a cushion under their knees. We put a folded blanket under their necks. Some of the women aren't comfortable lying down, so we set them up with what feels supportive. As you can see here, one of the participants is in a chair, and we put a cushion under her and a blanket over her body. We realize that the participants really enjoy this activity because they haven't had the time to just relax and just be in the space. And sometimes some of the women have actually fallen asleep and felt really restful afterwards. This is a picture of another way we set up the room in a circle to do a couple of activities. So we do some songs, we sing, and we also do an activity called the Web of Interconnectedness. This is an activity where each participant grabs a piece of yarn and shares something that reminds them of home. and then throws the yarn to another participant holding onto a piece of yarn, creating a spider web. And we talk about how this is a great way to connect with others. And even though some of us might be far from our loved ones, we're creating new connections in this space.
This is a picture of us doing a guided breath awareness practice. As I mentioned earlier, starting in the second session, we do a short breath awareness practice, similar to part of what we did today in this webinar, early in each session to help all of us arrive and settle in, relax our bodies, hearts, and minds even just a little bit. It's been lovely to see how people in the program have responded to this. We weren't sure at first how they would do with it, what they would think and feel about it. But people have really taken to it. I think that all of the moments in Alma where we offer the women participating an opportunity to rest and have a quiet moment with themselves are really appreciated and supportive to them. Here's a picture of some of the food that we eat in Alma. One of the women who participated in the very first of our Alma sessions is a professional cook. And so we talked with her and have now contracted with her to cook for all of our Alma sessions. So she makes home cooked warm meals for us for every Alma session, usually Mexican food that she learned to cook growing up. Sometimes different kinds of food. And this is part of how we grow in community together by sharing and taking in the sweetness and love with which she prepares this food for us and sitting with each other to eat and talk and enjoy it. Here's a picture of some of the women participating in one of the Alma sessions doing some mindful movement. The person whose face you can see is Veronica Poveda. She is the sister of the artist who designed our booklet and all the drawings for Alma. She has a background in mindfulness and yoga in Colombia and brings a wealth of expertise and teaching experience. So here she's doing some chest opening movements with women in the program to help us feel into our chests and what might be needed there and what might be beneficial to our bodies in that moment. Here's a picture of Gigi while we're doing a mindful eating activity. This is the mindful eating practice we mentioned. We usually do it with a mandarin, but in Washington State, we grow a lot of apples. And so in the fall, it's often really easy to get these little small apples. And it's just as easy to do the mindful eating activity with the apples, and also can deepen our sense of connection to all the people who help to allow this apple to be here in our hands and allow us to eat it, especially for people in the program who have some sense of connection to migrant farm workers who help harvest and care for the fruit in our state. It looks to me like we just had a technical difficulty, but maybe it's fixed now.
This is a picture of the gifts we give each participant during the last session of the Alma. Here's a tote bag with the Alma logo. We give them a candle as a reminder of the gratitude circle, where we all lit a candle and said something we appreciate about ourselves. We also have a mandarin as a reminder of mindful eating, a thank you card from the facilitator sharing our appreciation to the participants for being part of the program, a picture frame where the participants can put an Alma group photo that we take during the last session, and then we mail it to them afterwards. We wouldn't be able to do this program without our community partner organizations and our community advisory board. And here's the list of our Alma team and community partner organizations. But most of all, we're so grateful for the participants. We are just love being able to share the space with them and learn from each other.
So here is our contact information for both Gigi and I. We're so grateful to have all of you here with us today. We love to talk about this program. It's a joy for us to facilitate the program, and it's been a joy for us to develop the program, and it's a joy for us to talk about it. So we're really happy to be able to be here and do that with you. And we're going to move towards some question and answer time. So we hope that you will ask any questions about the program that feel helpful to you. We really are happy to share about any aspects of the program that might be of interest to you. So I'm going to turn it back over to Maxine now so she can facilitate the question and answer portion of the webinar.
Thank you, Gigi. Thank you, Serena. What an amazing treat, especially the portion where we all got to go through one of the mindfulness exercises, especially as the stress continues to mount through the pandemic. So you're starting to get some questions in, which to us is always great. First of all, as we want to echo what you ladies said. Thank you to everybody for showing up. We have a really great group from really all over, and it really just shows how, gente is willing to show up for each other and support each other. So let's get started. So multiple people have asked if this curriculum is available for purchase to offer in their community.
The short answer is no. We have not written up the curriculum and finalized it to a state of making it available or for sale. The current version of the curriculum is still all in Spanish. We are working on some publications that talk more about parts of the curriculum, but the best way to learn more about the curriculum is really to contact Gigi and I. We're happy to talk more about it.
Well, we're all going to be waiting on pins and needles for the moment when it is available for wider dissemination. So a couple of folks have asked, how are you able to do all of this throughout the pandemic? And kind of related to that question is, how, if you are continuing to do this, how have you made adjustments to it, whether it be virtual or social distancing adjustments? What does that look like via COVID?
Gigi, do you want to take that one?
Yes, of course. These are great questions. So we, part of the research study was that we were going to do 8 Alma groups, and we were able to do 4 groups before the pandemic. So since the pandemic occurred, we are on hold because now we are working on being able to offer Alma virtually. So Serena and I are going to start working on ways that we can modify the curriculum to be able to offer it via Zoom. We did receive some funding at the University of Washington through a Population Health Initiative grant, where we were able to pilot 2 Zoom sessions and do 2 mini Alma sessions. And we had a really great response. We had great participation from participants wanting to do it. And we realized that this is a possibility, and we got really excited. We also realized that, you know, we would need to have an orientation session for Zoom in order to ensure the participants know how to use it. And we realized that this would be a really great medium to be able to do Alma in the future. And Serena, I don't know if you want to add something that I might have forgotten.
I think that sounds great. I guess I would just say you kind of caught us in a moment of transition. So yeah, all of what we shared was really about Alma as it existed pre-pandemic, and the last almost half year now, we've been working on how to move it now into, well, first whether to decide whether to do it virtually, and now we finally, given the response we saw through the pilot version that Gigi mentioned, we've now decided to move it into a virtual space. So we're in that development now, and probably in January we'll be starting that.
Great. Well, everyone is super excited that you took the initiative to start this program in Spanish. And I know right now you said all of the written material is in Spanish. Is there a timeline for providing this eventually in English, and what does that look like?
As I mentioned at the beginning, the Alma program is part of a larger National Institutes of Health funded research study. So the focus of the program has been more on trying to understand whether the program is useful to those who participate in it, and if so, in what ways. The focus hasn't been so much on creating a curriculum to have for purchase or dissemination. That said, we do really want people to know about Alma and benefit from Alma, and we're in conversation with other organizations about how to help them be able to use what we've learned in Alma and use practices from Alma. So yeah, at this point, we don't have a plan for disseminating the curriculum. We're more focused on trying to provide it to as many women who are interested in getting the curriculum now. We don't have staff to be working on finalizing and publishing a curriculum at this point, but possibly sometime in the future.
Great. Okay. No, absolutely. I'm going to answer a question for you. Marta Reynoso asked if this presentation will be available via a link if we wanted to share it with colleagues. The answer is yes, absolutely. Also, we will be having this exact same session tomorrow live in Spanish. And so Serena and Gigi will be back to offer this in Spanish. So if you all are available, I suggest you come back to get the experience in Spanish. Also share the registration link that you all used with all of your friends, colleagues, community members who you think would also benefit from getting this information. So I'm going to introduce our executive administrative assistant, Ruth Yanez. She's going to help us out with the question that was entered in Spanish. She'll ask it in both languages for the benefit of those who don't understand Spanish, and we'll ask Serena and Gigi if you can answer it in both languages. That would be awesome. Ruth?
Thank you, Maxine. Thank you, Dr. Moore and Georgina. And thank you all for being with us today. I have a question from Alma, and I'm going to ask the question in Spanish first. So, hola a todos, bienvenidos, gracias por acompañarnos. Y como dijo Maxine, mañana este seminario web estará disponible en español. Así que si quieren tener la experiencia de un seminario web en español, los invitamos a que nos acompañen. Va a ser a la misma hora. Y la pregunta de Alma es la siguiente. ¿El programa se puede replicar en otro estado? Es decir, que nos den un entrenamiento para poderlo hacer. Estamos en St. George, Utah. La pregunta en inglés es, will this program, can you replicate this program in a different state? In other words, do you have like a trainer of trainers? And they are located in... So, Dr. Moore?
Sure. Okay, I'll answer. Sorry, the questions are moving around a little bit. So first I'll answer in English and then talk about it a little bit in Spanish. So we aren't at this point working with people in other states to replicate the program, but certainly anyone could contact us who is interested and we could have a conversation about that. En este momento no estamos hablando con gente en otros estados para entrenar a alguien para hacer el programa en su estado. Pero por favor, hable con nosotras. Nos gustaría hablar con usted para ver cómo pudiéramos ayudarle en pensar en cómo pudieran hacer un programa como así en su estado.
Beautiful, thank you. We decided to do that one in Spanish and in English because a few folks had asked about the training of trainers, and I knew that you didn't have a curriculum, but wanted to just kind of honor the opportunity to do it in both languages. So thank you, and thank you, Ruth. And Ruth will be your host for tomorrow. So for those of you who can make it back tomorrow, please come ask some questions, let folks know, to be prepared that as much as they want it in their state, it's not ready yet for that opportunity. Let me see. So Anabel asks, what are some of the changes you have seen in the participants who have, gone through the Alma program?
Gigi, do you want to respond?
Yes, I can start and then you can add to it. Yes, we've noticed some changes, especially when we run into the participants afterwards, that they are able to not only do the practices during the sessions, but able to still do them. And they get back to us and let us know, like, I'm still breathing, I'm still trying to do all these different things. And so that's been really exciting that they have shared that they really enjoy it. And then they'll recommend other women to come to the program and refer them to us so that they can also participate. We also, through our surveys, we have some preliminary findings since we are not having completed the full study. We have seen some promising results. And so that's been nice that the program has been beneficial in helping the women with stress reduction. And so, yeah, those are some of the things that we've been really excited about seeing and being able, and some of the women are just excited to be able to learn some of these new tools and be able to incorporate them in their lives.
I would say another piece that comes to mind there for me is, as you heard, we spend a lot of time focusing on self-compassion, and we've taken an iterative approach to the curriculum development so that each time we facilitated one of the series of 8 sessions, we look back at the curriculum and see what might we do differently for it to work better next time. And one of the things we've been doing in making changes is changing the words we use. And early on, we were using autocompasión for self-compassion, so a pretty literal translation. And we've moved away from that and talked more about, use terms more like darte cariño, or more simple terms, because we found that sometimes it felt like the idea of self-compassion itself is already such a challenging notion, because both for the cultures that different women are coming to the program from and from the culture that we are working within in the US, where we are all doing the program, there's not a lot of talk about self-compassion. In fact, there's often some putting it down or saying it's wrong. So one thing we noticed even early on when using autocompasión is that even though it took people a while to sort of feel in their bodies what that meant, towards the end of the sessions, we would see some kind of like aha, like people understanding it and having quite emotional responses to this feeling that they were starting to feel in their bodies and their hearts around what it is to give ourselves love and care. And so we've seen that be even, I think, a little more accessible as we've changed the language. But it's been really so sweet and heartening for Gigi and I to watch participants go through this process of kind of sinking into what it means to actually love and care for ourselves.
How amazing. I love that, you know, consistent evolution based on what you're seeing from the participants themselves. And I have to say, speaking as a Latina who also happens to be a mother, when you all were talking about the fact that for some of these women, it's like the one time they get to kind of be by themselves and with themselves, it's such a beautiful representation of how really busy our lives can get. And you know, whether we work in the home or we work outside of the home to earn money or any of those pieces, really this opportunity as a mom, because I know that you work with women, you know, as a mom to really like spend a moment by ourselves or with ourselves, I think is just so it's such a beautiful piece of self-care, you know. And so thank you for giving that gift to women, that we can just take that moment to ourselves, and that it's nothing to feel guilty about, and that it's something we can do in the midst of our busy lives. So thank you for that. A few folks have asked where you get your funding from.
So this project has changed over time and had some different funding sources, but this is the largest version of the project so far. We tried for some years to get National Institutes of Health funding for the project, and we finally succeeded a few years ago. So this fuller version of the project is funded by NIH, National Institutes of Health.
Perfect. Okay. Thank you. So there's a comment in the chat box that I'm going to also turn into a question. So Annabelle said, I can see this resonating in Native American communities since some of the concepts of ancestors fall in line with beliefs. So to that end, I know that you're working with immigrant Latina, you know, women. Have any of your participants, to your knowledge, are they part of indigenous groups? Do they speak about that portion of their heritage, if they are?
Gigi, do you want to talk?
That's a really good question. I know, so I was first part of the pilot in North Carolina when I was working at Duke, and we did see participants that had more of that background. And this version, we maybe have had maybe one or two. It's been less than, but many of them have had backgrounds and come from different indigenous backgrounds. And so I feel like it would be very applicable to that population.
Thank you. A few of the folks have asked a similar question. You spoke about the groups being 25 individuals. So two different folks asked slightly different questions. Alma asked, is the number of participants, does it have to be 25 or can it be less? And then Kelly asked if having 25 participants ever feels too large. And have you ever considered using smaller groups or working with smaller groups at one time? So I know it's a stacked question, but they're similar, so.
Mm-hmm. Sure, I can talk a little bit about that. So the reason we have 25 is because it's a big NIH funded research study. And so we're trying to get enough women participating in the program to actually show that this kind of programming, show whether or not this kind of programming is helpful in preventing anxiety and depression amongst Latina immigrant women. That said, we also want it to be as available to as many women as possible who want to do it. So we're happy that it's 25 in that sense. When we do have 25 people in the room, it is a lot. It's very different. We work with 2 different community organizations in the Seattle area, and it's very different depending on where we are and how big and solid of a group the organizations have. So in one organization we work with, there's already an existing women's group that is very regular in their attendance. And so when we did the sessions with that group, there were almost always 25 women there, and that was a lot. But because they had existing relationships and they'd already developed a kind of culture within their group of how to be with each other, it worked. I think that 25 women who didn't know each other is potentially more challenging. And at the organization where women are coming from all different places and aren't part of a set women's group, we tend to have smaller numbers. And I think that is really linked to them not having as strong of a connection to the community organization and to each other. So we've gotten to try it also with smaller groups. And that's been different in some ways. Feels helpful to have a space where more people are able to talk, especially people who don't feel comfortable speaking in front of so many other people, and just having them more time and space. And then I would say on the other hand, there's also some loss of energy. There is something about a room full of 25 Latina women that know and love each other, that has a really strong energy to it that is really helpful can be really helpful for what we're doing.
Thank you. I know it's always, there's never a magic number, right? And it's always this kind of like adjustment. And I've facilitated groups where 25 folks wasn't enough just because of the dynamic of that group, you know? So I know it's a constant adjustment that we have to make as facilitators. So Daniel Magos had a comment and a question. So while Daniel missed the very beginning of today's webinar, Daniel does plan to join tomorrow. So we're super excited about that. But the question is, Daniel's curious about the effect of survivor's guilt. For example, coping with living in the US while family in the home country might be living in worsening conditions. Do you all ever touch on, this notion of survivor's guilt?
Gigi, do you want to start or do you want me to start?
Start a little bit and then you can start. So we don't focus exactly on survivor's guilt, but I do want to say that that comes up a lot during the session when the women reminisce and talk about their family and loved ones that are at home. And especially during the activity where they talk about their migration journey and just kind of being here in the US and leaving family behind, and really trying to talk about the struggle they have with justifying, like, did I make the right decision? And I know that this is the best because I'm providing, finances for my family, financial support, but it's also a big struggle for them to be able to be here, without their loved ones. So I know throughout Alma, that is something that comes up, and many of the practices we try to incorporate with a lot of self-compassion and love, and being able to bring our loved ones and connect with them, even if they're not with us presently, but, in our background and our life. So that is one way that we have incorporated that.
Yeah, I'll just add to that. Yeah, I agree that so much comes up about family, especially family back home in home countries. And we try to really give the space for the participants in whichever group we are working with at the time to really express what's true for them in their relationships with their family. So yeah, sometimes something like survivor's guilt comes up. There's also so many other emotions, like real sense of missing family so much and wishing that family could be there closer to support them. A lot of loss or sense of grief at not being able to be present with family members who are sick. in some cases, family members who have died back in home countries, and people in the program haven't been able to be there with them. So we really try to give space, and then we have a number of different opportunities where we really try to touch on family and help participants express emotions they're feeling about family here in the States and back home, and also really feel that sense of connection and support with each other. It's so touching to watch them recognize similar emotions about family in other participants, and to notice that even physical, you can see in their bodies a sense of relief at not being alone in that.
How beautiful, a way to connect even in that physical separation, which also kind of speaks to what's happening with COVID, right? So many of us, might even live in the same community, but have gone through this time where we've been separated physically from family members. And so I know that it's a way to help put it in perspective for those families who are separated by space. So thank you for that answer. So I'm going to just kind of address a comment that Miriam made. Miriam said, what an amazing world this would be if we could nurture everyone like this. Sigh. So a little bit of good news. When we post the recordings and the PDF copies of this PowerPoint on our websites, we will also be sharing with you all a one-pager, a fact sheet that Serena and Gigi have put together that gives some of the main tenets of the Alma program and how we can start to practice self-compassion. These will be great tools for you all to use in your everyday lives, but also to share with folks that you know who can use them. And so we want to send a special thanks to Gigi and Serena for creating those fact sheets for us. Those fact sheets, like the recordings and the PDF slides, will be available in English, Spanish, and then soon in Portuguese. So just wanted everyone to know that. All right, so we have another question that was entered in Spanish, and so Ruth is going to read in Spanish and in English, and then we'll ask the ladies to answer in both as they did earlier. Ruth?
Thank you, Maxine. So Alma has, and I will be asking the question in Spanish first, and then I will move and ask it in English. So Alma pregunta, en el caso de violencia doméstica, seguramente funciona muy bien en muchos casos, pero en su experiencia con el programa, ¿habrá algunas personas que les cueste más trabajo por las experiencias vividas en violencia doméstica? In English, the question goes, in the case of domestic violence, the program probably works well in many cases. In your experiences with the program, do you have people that have a harder time sharing due to their lived experiences with domestic violence? So Gigi or Dr. Moore?
Do you want to start, Gigi?
Yes, so I'm trying to think if I should start in English and then I can do it in Spanish, and then Serena, feel free to pipe in. I definitely think that Alma is a space that for some of the women, it's hard to open up and to talk about some of the things that are going on. But then once the sessions go on and they feel more supported, some of the women do open up about some of these issues or some of the things that are going on in their lives. And the good thing about Alma is that we also provide women referrals or resources in the community to help them out and connect. But also, we also honor the fact that some of the women might not be ready to talk about some of the things and are able to just kind of take in some of the things with Alma and then later revisit. I've had participants contact me later on to just kind of consult with me and get some information and be able to be referred due to just being able to build that relationship with us. I mean, this is a program that, women come in and don't know anything about us and know some of the women. And being able to slowly and gradually create a connection with other women will give them a safe space to be able to open up and ask us for anything that they might be able to, find out in the community. And so I feel like that's been really beneficial with the program. And I'll try to remember what I said in Spanish. Hemos tenido personas que sí han tenido esas experiencias de violencia doméstica. Muchas de ellas están cómodas de compartir las experiencias que han tenido, otras no, pero con el tiempo, con las sesiones, con la conexión con otros participantes, se sienten más cómodas y muchas de estas cosas pueden ser compartidas, y a veces hemos tratado de referir a las personas para que tengan más ayuda en una agencia mental o una red comunitaria. Y también he tenido una experiencia cuando una participante me contactó después del programa porque se sintió cómoda, supo quién somos, tenía una relación con nosotras, y entonces pudimos ayudarla y conectarla con otros recursos. Pero a veces también podemos saber que a veces la gente no está lista para hablar de estas cosas, y está bien. Entonces nos damos cuenta que la relación con las participantes y todo eso, la conexión, es muy importante. Serena, I don't know if you want to add anything else.
I think that's good. Gracias.
Thank you. That was beautiful. We appreciate that. All right, we have a few questions left. We will do our best to get through all of them. Any of the questions that we don't get to live, we will make sure that we post essentially like an FAQ addressing the questions on our website that didn't get answered today. As you work with Latinas, how do you address differences in cultural groups, countries of origin, differences in spiritual beliefs, and generational groups?
I think that one of the sweet things about Alma is the opportunity for Latina women to come together across some of those differences, and to experience sharing and listening in an environment where we really consciously work at creating openness for everyone. So I would say we try to remember to really point to different experiences people might be having. If we're bringing up different things, like Gigi talked about the tree of stressors, we try to have stressors that would fit for people who have different relationship to age, race, country of origin, physical ability. In our migration story sharing, we try to also give space for real different experiences. We've had some women who come to the US. We've had very few women who come to the United States with legal documentation. And sometimes we've had women in the program feel some guilt that they have not experienced the trauma, the different kinds of trauma and the different kinds of emotions that other women are experiencing related to their undocumented status in the United States and their undocumented migration. And we really try to create a space in those moments where we're saying that, you know, this is a space for everyone's experiences, and offer the women in the program ways of supporting each other across the differences that they have between them. I don't know if you want to add anything, Gigi.
Yeah, I can just add. Also, it's been really interesting to see the women from all different backgrounds. And sometimes, you know, they'll say one word a certain way, and then other people will say other ways. And just being able to learn from each other and appreciate each other has been really cool. And also with the potluck at the end, women will bring stuff from their home country, and everyone's welcome. And we really value that in the program.
Beautiful, thank you. So a few folks have asked a similar question. What are your marketing or outreach strategies to get women involved in this program?
I can start, and then Serena, feel free to pipe in. Yeah, so what we've noticed has been the most successful way to disseminate the information or share what we're doing is once the participants have done the program, they'll tell their friends, their loved ones, people in the community. And so that's been the biggest way to recruit people. We, as Serena mentioned, we work with 2 community organizations. So for example, one of the community organizations already has an established group. So we're able to recruit women from there. For the other ones, we go out and paste flyers. We send out, an email with a flyer to our community partners. And we try to send out, have a Facebook post through other agencies, through the University of Washington or other organizations that are able to let other people know about the program. One of our biggest recruiters and helpers is a woman that helps us make the food during the sessions. She has been really great at being able to help us connect with people in the community. So that's the way that we've actually been successful in recruiting.
Beautiful. Okay. It's, word of mouth always works really well in our community since we rely so much on each other to, to take care of each other, really. I think we'll have time for one last question live. Everything else, like I said, we will work with Dr. Maurer and Gigi to get answers typed up and then put on our websites. Is there a program component that connects participants to relevant community resources?
Yes. We do that in a couple of different ways. In one of the sessions, we pass out a community resources sheet, and Gigi spent some time talking a little bit about the resources and trying to help women in the program feel comfortable contacting the resources. We notice that often, we can give out resources, but people don't necessarily feel comfortable contacting them. So we do spend some time explaining what it might be like to call an organization and also offer, we always offer for any participants to come talk to us after, but especially around this. We've also invited some people in from different community organizations to talk with our participants, like while we're having our meal at the beginning, for example, just to help people connect with a face and hear directly from that person what their organization is about and how it might benefit them. And then our interviewers who do the surveys with all the participants also have community resources available to share with people who are asking for that or expressing some kind of need for that.
Great, thank you. Well, we have come to the end of our webinar. I want to say a giant thanks to both Dr. Maurer and to Georgina. She asks to be called Gigi, so as you all heard me call her that. Thank you. Thank you not only for presenting this wonderful opportunity to us today, but for everything that you're doing in our community and what you're doing for these women, because we know that it creates a positive ripple effect in their families, in the local community, and then in our community overall. Thank you for taking time to teach us how to care for ourselves as we are caring for others. Next slide, please. Here you will find contact information for our National Hispanic and Latino ATTC, as well as our parent organization, NALBA. We'd like to encourage all of you to go onto our website, join our Juntos network to get free updates on all of our events, including ones like this. Also you can find us on Facebook. You can also find us on Twitter. We ask you to like us on Facebook, follow us so that we can continue to share relevant information with the community. You can also reach out to us to request free training and technical assistance. Next slide, please. One last quick reminder and a big ask. You have been receiving the satisfaction evaluation link throughout the presentation in the chat box, but you will also be immediately redirected to our satisfaction evaluation. We ask that you take a couple of minutes and fill out this form, provide us with your feedback. It's really important to us. We do read every single one of these, and it helps inform our future work. Again, we thank everyone for coming today, for the wonderful participation. Thank you, Serena. Thank you, Gigi. We hope everyone has a wonderful day.
Thank you so much.
Thank you.